I am the principal investigator of the COSTAR Project, which is evaluating a psychosocial intervention for refugees in Rwanda and Uganda. COSTAR Project is funded by the Economic and Social Research Council and the Arts and Humanities Research Council in the UK. It features a collaboration between the University of Liverpool, the University of Rwanda, Makerere University in Uganda, and the University of Glasgow. The full title of the project is Treating Depressive Symptomology in Congolese Refugees in Uganda and Rwanda, Adapting and Evaluating Community-Based Sociotherapy. COSTAR stands for the abbreviated title, which is Community-Based Sociotherapy Adapted for Refugees. Large numbers of people have been forced to flee the Democratic Republic of Congo. There are estimated to be over 780,000 refugees from Democratic Republic of Congo who are accommodated in other African countries. For example, Uganda has over 280,000 DRC refugees, whereas Rwanda has over 80,000 refugees from the DRC. Research evidence suggests that the population in the DRC, particularly the Eastern DRC, are subject to elevated levels of mental health difficulty as a result of the conflict that is ongoing in that area. Research has also indicated that there are elevated levels of mental health difficulties amongst refugees from DRC. Community-based sociotherapy is a group-based intervention that has been used extensively in post-genocide Rwanda to help facilitate community healing and conflict transformation work. The World Health Organization has described community-based sociotherapy as an intervention that uses the interactions between individuals and their social environments to facilitate the re-establishment of values, norms, and relationships, and at the same time provide the opportunity for debate, sharing of experiences, and coping mechanisms. Community-based sociotherapy is delivered in 15 weekly group sessions that can be of up to 3 hours duration. Group members are facilitated to focus on 6 different phases: safety, trust, care, respect, new life orientations, and memory. The COSTAR project is focusing on 2 separate phases of work. Phase 1 is concerned with conducting situational analysis in Gihembe refugee camp in Rwanda and in Nakivale refugee settlement in Uganda. Phase 1 is also concerned with doing community engagement work to adapt community-based sociotherapy so it is tailored to the needs of Congolese refugees living in Gihembe and Nakivale. We're also seeking to adapt assessment measures that have been used extensively in sub-Saharan Africa, but have not yet been used with Congolese refugees. That phase 1 work is in preparation for phase 2 commencing. Phase 2 is a cluster randomized controlled trial of community-based sociotherapy. We're seeking to recruit 720 people across both Rwanda and Uganda. People will be assessed at baseline at 16 weeks post baseline, and then at 32 weeks post baseline. This will allow us to track changes in both groups across those time periods to determine whether community-based sociotherapy is efficacious in bringing about change in levels of depressive symptomology. We're very much looking forward to working with our collaborators, allowing those relationships to grow, to engaging people who have a lived experience of being a Congolese refugee in Gahembe and in Naka Valley, so that they can have an active voice in the work that we're doing.